meeting, and we're going to put it on your Moodle site so that you've got reference to it. So let's start by introducing myself. So I'm Minesh. Now, some of you may have met me, some of you haven't met me. Can everyone just write down if they've met me before? And if you haven't, just say you haven't met me before. Okay, no, Oscar. Nice to meet you, Oscar. Nice to meet you, Beth. Nice to meet you, Stefan, Mary, Lalja, Salani, Oscar. Who else is there? So it looks like I haven't met any of you before. So let's Chetra. Nice to meet you all. Sometimes you can put this webcam on, but if everyone puts their webcam on and puts their mic on, the system will get overloaded. So it's better, we just have one webcam on, and we have just one person speaking. So let me tell you the format. Now, at any time, if you want to just ask a question or stop, just put it into the type, in the chat box, and I can see what you're saying. And any questions, just leave them there, and I will go through them as the course of the webinar is going. So let me introduce myself. As I say, I'm Minesh Patel. Let's put this on. This is me when I qualified. You can check out the mush. I don't have that anymore now. I still feel this young, by the way. I qualified in June 1986 from Cardiff. I started my career as an SHO in oral surgery. Then I worked in practice for a period of time. I did all my sort of primary qualifications. I got MFGDP as it was at the Royal College. And I did various degrees. I did various courses throughout the UK, Europe, and America in implantology and restorative. Eventually, I did a master's degree in implantology at Warwick. I was going to do mine at the Eastman, but at that time Eastman weren't teaching the placement of implants. They were just teaching the theory, and so you weren't placing a lot of implants. Then I did a master's degree in restorative and aesthetic dentistry as well. I'm currently course director in implantology at Warwick as well. I'm an examiner for the diploma in implantology at the Royal College of Surgeons. I'm a mentor for the ADI. I started my time at Warwick teaching the bone grafting module for the MSc in implantology at the University College of Midlands in the cadaver room. So I did that for a number of years, and sort of still involved with that to a degree. I did a law qualification as well, and then did an educational PG cert as well. I'm in practice and have been for about 29 years. I'm also an FD trainer. The two practices are quite large practices, and so I'm a trainer in one practice, and my wife is a trainer in the other practice. This is one of the practices, so it's a 5 surgery practice. And we have the building goes all the way back there. And this is the other practice we have, both in Hertfordshire and Bedfordshire. Both practices have hygienists, altogether about 10 associates, a team of receptionists. We actually have an osteopath here as well, and a podiatrist. We're also an all surgery centre as well. So that's me. Essentially, if you need, during the course of this webinar, you're all going to have a number of cases that I know about, that you're sort of either submitting or in the process of submitting. I've looked at, I can't recall all the individuals in detail, but I've got a spreadsheet of everyone's progress and how they, where they are currently. What I'd like to do is, I would like to, one by one, have a progress meeting with you all, so that I've introduced myself personally to you all, and also get a feel of your restorative abilities to date, and where I can help you. I will either sort of as a one-to-one, but primarily look at your cases and see where we feel you could improve to a degree. Now, what I'd like to do is, I'd like to present, just one second, let me just put this up. I'd like to present a case that I did a while ago. I presented this one case. I'm just going to stop sharing my screen, because I've just got to make sure that the screen works well. So just bear with me. Can I ask, within the group that we've got there, would anyone in the group like quite an urgent meeting with me, just to iron out anything that you feel that you do? And I'll make in fact, to be honest, the easiest thing to do, if you would like an urgent meeting with me, please don't hesitate to email me via the Warwick site, so that I can help you. So you can all see. Good. Right. Sorry about this. I'm just going to. Right, Oscar. Yeah, brilliant. If you could just email me on my Warwick email, then I'll get back to you with various times. The times that I like to do the tutorials are usually on a Wednesday night. So sometimes. So thank you, Johnny, as well. I'll arrange that. So if you could all email me individually that you would like an urgent tutorial, I would like to go through all the students one by one and just have a record of the meeting. Generally, what we do is we have what we call a progress meeting. So in that meeting, the university would like to know how your progression is working. And I have to report as course director to the university and to the exam board from time to time how your progress is going. So it's very important that you keep me in the loop as to how you're progressing. If you're having difficulties, you've all got dates when you have to finish, that you have to finish your cases. you should be very aware what these dates are, because as you approach towards the end of your time at Warwick,